Good evening, I'm Karen Larson.
I'm Brian Sanders. Thousands of Oklahomans struggle with mental illness every day.
Two Works for You is working to make sure that you or your loved ones know exactly where to turn for help. We teamed up with Laureate Psychiatric Clinic and Hospital here in Tulsa to get your questions answered.
So professionals are waiting by the phone. The number to call is scrolling across the screen right now. You can also join a live chat on KJRH.com, or you can tweet in your questions using the hashtag 2WorksForYou.
Now, 2 Works for You reporter Joe Hankey visited the Tulsa County Jail's mental health unit.
He tells us why treatment behind bars is one of their last options.
Hey, Tara. How are you doing this morning?
Inside the Tulsa County Jail.
I'm Kathy with Mental Health, and I just want to check on you today.
A small staff takes care of a growing problem. As Kathy Lohr and Patricia Benoit with Armor Correctional Health Services walk through the jail's infirmary, they tell me of the 28 medical cells on any given day, individuals with serious mental illness fill 15 to 20 of them.
Yeah, you're okay here? Okay, as long as you're by yourself. Okay.
It's solitary confinement, bare cells, a toilet, a plastic bed, for inmates who are a danger to themselves or others because of their illness. Once released from jail, many inmates end up here again, often due to self-medicating.
Public intox, whether it's alcohol or drugs, they just keep coming back. You'll see some people with 20, 30 PIs.
Detention officer Melissa James says in the infirmary, she sees firsthand the need to help those with mental illness. And some experts say many have run out of options for help beyond the jail's walls.
All of them need 15-minute checks instead of 30-minute checks. So we constantly have to observe them. And they have outbursts, they have psychotic breakdowns. It's a constant, never-ending, 24 hours.
In April, crews broke ground on the jail's new mental health pod. It is a reaction to the increase of inmates with mental illness. The pod could open in 2016 with 10 to 12 suicide watch cells and 98 beds for the mentally ill.
By creating the mental health pods, they're going to have a better sense of community.
Jail staffers say fewer inmates would need help if Oklahoma increased services for substance abuse and identified mental illness earlier.
Then the kids have a lot better chance of parents recognizing it or people working with the family recognizing their problem and getting them stabilized before it just becomes chaos.
Lohr and Benoit will be here, though, willing to help as many inmates as needed as they try to control the chaos.
All right, have a good day, okay?
Knows the jail's infirmary holds 15 to 20 mentally ill inmates on average. Inmates with less serious mental illnesses receive help in jail but are mixed in with the general population. For the entire Tulsa jail, the sheriff's office reports on average 40% of inmates have some sort of mental illness. Joe Hankey, 2 Works for You.